Well, hello everyone, and welcome to tonight's EllieMD educational series. We're excited to have you here as we continue our mission to support healthier, longer lives. At EllieMD, we're more than just a telehealth company. We offer education, community, and innovative healthcare solutions to guide you on your wellness journey. Tonight, we're changing things up and doing things a little differently. I'm here in beautiful Los Angeles with our LA team. And as you can see, I'm co-hosting with Janet. Janet, why don't you say hello and introduce tonight's guest?
Yes, happy to. Hello, everyone. Good night, good evening, wherever you are. As Honey said, my name is Janet Jones. I'm the Director of Operations here at Ellie. I've met a lot of you, but I'm excited to see a bunch of new faces. So happy to be here. But enough about me. Our guest tonight, Charlotte. She's a passionate and highly experienced board certified PA with nearly 18 years in clinical practice experience. She's not just a medical expert, she's a Duke trained integrative health coach and national board certified in health and wellness coaching. Charlotte has worked across diverse specialties from surgery and internal medicine to hospice and palliative care, all while mentoring future healthcare professionals at Johns Hopkins' Sibley Memorial Hospital and the University of Washington School of Medicine. Her dedication to cutting-edge, patient-centered care led her to advanced training in functional medicine and clinical weight management. Charlotte is currently pursuing certifications in peptide therapy and bioidentical hormone replacement therapy.
Oh, that's awesome. What a background. Well, Charlotte, welcome tonight. Can you please share a little about yourself and tell us how did you become an integrative health coach and why are you so passionate about this field?
Well, thank you so much, Honey and Janet. It's lovely to be here tonight with everyone. So I was born into a medical family. My father is a physician, and I used to accompany him to hospitals as an infant all the way until I was about 12. And I would go into the hospitals and I would spend time with patients and I would crawl up on their beds and I would tell them stories or, I was a very little child. But what I really was drawn to was the interaction with other humans and seeing that medicine is so much more than just the prescription that you write. It's the interaction, it's the connection. That's where the healing lies in being able to make that connection and encourage trust and facilitate understanding. And so that's one of the things that really drew me to medicine. And I trained to be a PA. I'm board certified. I've worked across the United States in various places. I've worked in academic medicine. I've worked in clinical outpatient. And I've enjoyed all of it. And so the educational piece is something that's really important to me. And one of the reasons that I love being here on this platform, because I feel that education is power, and especially for women to have that understanding and the knowledge to feel more empowered about their health, I think is a really beautiful thing. And I'd love to encourage that.
Love that. And I remember from our very first conversation, that was the topic that we can really have an impact in the world of healthcare by educating. And you're so passionate about that. And even on tonight's topic, when we were talking about it, I was like, Charlotte, pick something that you're passionate about. And so I'm excited for tonight's conversation. Let's start with inflammation. In the world of longevity, we call it inflammaging. Inflammation is important when it comes to longevity. Can you talk to us a little about inflammation and how it plays a role in our overall health?
Sure. So inflammation is something that the body naturally does. It's a natural protective response to harmful stimuli. There's two types. There's acute and chronic inflammation. And the acute inflammation you see, like if you sprain your ankle and suddenly it hurts really bad, it gets red and swollen, it's hot, it's tender. That's acute inflammation. And what happens is the body goes in and the goal is to eliminate whatever caused the issue, clear out the dead cells, stimulate tissue repair. But what can happen long term is if that process goes on, it can cause other problems in the body. And that's what we run into. Acute inflammation isn't something we want to necessarily discourage, at least in certain circumstances, but chronic inflammation has a real big role in so many different disease processes, from cardiovascular disease to hormonal imbalances to metabolic syndrome, diabetes, autoimmune issues, weight. So it's really wrapped up in a lot of different things.
Wow. And so what are some common signs that someone may be dealing with chronic inflammation?
So, well, it kind of one of the lab values that we look at is something called C-reactive protein. There's another one that's an older test. It's less specific. It's called the SED rate. We can look at other labs too, but what you generally see is people who might have persistent infections or they have things that just don't really make sense. Maybe people are having headaches or they're having weight gain or they're having trouble with autoimmune issues or they're having hypersensitivity reactions to various foods, which is a really big source of inflammation. So it's kind of just a generalized picture. People will have joint pain, and it's not just, I fell down and got a bruise, but like my joints hurt all the time, or my fingers are swollen, or there's a lot of things that kind of look like chronic inflammation.
You briefly mentioned this at the beginning, but we wouldn't have inflammation if it wasn't beneficial for the body. So can you talk to us about how inflammation can be both beneficial and harmful at the same time?
Sure. So again, in an acute setting, so say someone gets a virus, our body goes into defense mode and it goes in and it starts revving up the immune system to say, hey, we got to get this thing out of here. This is not allowed. It really goes in and mounts an immune response to it. And that is really beneficial because we have all of these wonderful cells that come in and start to clear out the virus or bacteria or whatever it is that's causing the initial insult. And so we want that to happen because that's the body working as it should. But the problem is if we have an over exaggeration of that, like I stub my toe and suddenly my whole body is swollen. That's like a total exaggeration. But it's that degree where, wait a second, this amount of inflammation doesn't match what's happening. And then that's what causes this cascade of events through the rest of the body that can cause other health problems.
Yeah, and so like as we age, our hormones have a lot to do with that inflammation. And so can you touch a little bit on how hormonal changes in perimenopause and menopause contribute to that increased inflammation?
Absolutely. So the wonderful thing about women is we have this beautiful hormone system that's super complex. Men have hormones too, but theirs are a little easier to manage. But for women, the three main hormones that we have, the sex hormones, are estrogen, progesterone, and testosterone. And as women age through their late 30s into their 40s and sometimes into their 50s, when they enter into perimenopause, which is the transition between premenopause, which is you are cycling normally, the hormones are functioning normally, and menopause is when menses stop and for at least a year. So perimenopause is when everything goes haywire. I mean, the whole system is, going crazy. People have symptoms all over the place, and it's literally because your hormones are going up and down like a roller coaster. And they don't go down in a linear fashion. They are all over the place. So that's why you're getting hot flashes one moment, you're sweating in the bed the next, you're screaming at your kids or your husband or whatever. You can't sleep. You go into a room and like me, I left my phone in the refrigerator the other day. And, I mean, it's that. So, but that is due to the shift in the hormones. So estrogen is one of our main hormones. And as estrogen decreases, inflammation goes up. As progesterone decreases, and that's one of the first hormones to decrease in perimenopause, inflammation goes up. It also causes insulin resistance to happen, and that's when the body naturally produces a substance called insulin to bring blood sugar down. But what happens is suddenly the insulin doesn't work in the same way. So now you have elevated blood sugar, which then causes other problems in the body. And it's not to the point where you're diabetic, but it's in this kind of like low grade insulin resistance where people are gaining weight. And so all of a sudden you're in perimenopause, you feel terrible, your hormones all over the place, you're gaining weight, and it's so insulting because you're like, wait a second, this was supposed to be okay. But that's all related to the inflammatory process of those hormones decreasing.
I love that. Thank you for touching on it. So, on that topic, what are some of the symptoms people should look for? You mentioned weight gain, the insulin resistance. So there's weight gain. What other symptoms should people look for, and how can they manage it?
So it's a great question and it's kind of a complex answer, but there can be a variety of things that happen. So in terms of what you're looking for kind of from a hormonal standpoint, you may have change in your menstrual pattern. So suddenly your menses get shorter, so shorter in duration between cycles. So maybe you're at 20 days as opposed to 28. You may have irregular bleeding during that time. You may have memory issues. You may have brain fog. You may have some mood changes, trouble sleeping. You may feel wired and tired. And that's actually because what can happen during this time is as the hormones decrease, we have a system that regulates our cortisol production. And as these hormones drop, the cortisol levels can go up, which is part of the reason you wake up in the middle of the night and you can't sleep. And you're like, why am I awake? I was tired when I went to bed and now I feel like this. So everything is really shifting. And it's just, there's so much disruption in the system. So those are some of the things that you will see commonly.
And so now that we know kind of what to look out for, what we will see in our body, are there any specific like hormone balancing strategies that you have that can maybe help reduce inflammation during that like midlife
Absolutely.
time?
Absolutely. So there's a lot of things that women are already doing, but one of the most amazing ones is exercise. So making sure that you're moving your body. So not only does that help our mind, it helps our heart, it helps our emotions, it helps all of these things, and they're all really interwoven with each other. So that's one of the beautiful things about exercise. It is proven to decrease inflammation. So diet too is another big one, and I'd love to talk more about the diet, but diet really can help modulate some of the inflammatory changes that can happen. So what you're putting in your body to fuel your body really does have an impact on how much inflammation is in the body. Sleep, which, in perimenopause, you're having trouble sleeping anyway. So when someone says, well, you just need more sleep, that doesn't always work. But sleep is really important. So that average of 7 to 8 hours of sleep is so restorative for our brain and also helps our brain health because our brain cleans itself up at night. Let's just put it that way. And if the brain doesn't sleep and you don't allow it to rest, the brain gets some extra materials for lack of a better word, that can cause trouble thinking. So it's like, wait a second, my brain just isn't working after the night I woke up at 2:30 and I couldn't go to sleep until 5:30. So making sure that you have a set sleep-wake schedule is one of the things that can be really helpful. And the screen time before bed is a hard one for people to break. But if you can get off of your screen, or you can shift the light on your phone or your like on your laptop to a red light, that can also change the way the blue light is coming in and being filtered by the brain. And so that allows the natural melatonin production, which then allows you to sleep a little bit better. One of the other things that's so wonderful about women in general is our sense of community actually is a health aid. So that connection that you have with loved ones who support you, with other women, with friends and family, that is healing in so many ways. And that actually is shown to decrease our inflammation because it decreases our cortisol. So that's free too. Obviously, exactly. And so finding your tribe, finding the people who make you joyful, who lift you up, who really share their heart with you is so healing. And of course, having some sort of hormone replacement therapy is also very beneficial. That's a bigger topic, but that does reduce the inflammation because you're restoring the hormones that are being lost due to aging. Now, there are some other supplements that can be used during this time period, but everyone has a different response to that. So in general, there are a lot of things that you can do, and they do make a difference, and they're additive. So it's not like one thing is going to be the solution. They all add up.
Oh, Charlotte, I love that. I'm going to make a list of all the toxic people in my life and I'm eliminating.
Thank you for reducing my inflammation.
There you go. So this is a topic I know you're extremely passionate about, and as am I and our community, peptides.
Mhm.
There's a lot of peptides, and there's so many benefits to peptide therapy, and especially when it comes to inflammation. Maybe for individuals who are new to this call, they've never heard of a peptide. Maybe you can explain what a peptide is and what specific peptides help with inflammation and reduction of inflammation.
Sure. So peptides are amino acids, and they are molecules that are signaling molecules that are in our body that tell us what to do. We have, I think it's over 7,000 peptides in our body. And we first started isolating peptides back in the 20s, so 1920s. I should give a preference for that. I'm a little older now. So, and that was with insulin, and since then there have been a whole host of other peptides that have come out. But in terms of the peptides that we're really focusing on, the GLP-1s first came out about 20 years ago. The first one was Byetta, and that was a daily injection for type 2 diabetes. And then over time, there have been different variations of the GLP-1s. It's still the same family, but the medications have changed and they've been updated. So that's what a peptide is. And in terms of what GLP-1s are, so GLP-1s help uh, in a variety of ways, and they are used for various different diseases from type 2 diabetes to obstructive sleep apnea. There's now an indication for chronic kidney disease, and obviously for weight loss. So there's medications that can help with inflammation. That include these GLP-1s because what they do is they regulate some of the immune cell signaling and they decrease the inflammatory cells and then they increase the anti-inflammatory response. So that is in addition to all of the other benefits. So that's one of the things that they're so wonderful about.
And so if we're on a GLP-1 or even if not, adding on top to kind of help supplement that, what are some of like the biggest dietary culprits that, contribute to that inflammation? Like what should we stay clear of? There's so much mixed information like on media. So where should we go?
Sure, and there really is. And, I can share a lot of dietary information, but ultimately it's up to you and what your body responds best to. There is no cookie cutter approach, like truly. Some people will say this diet is the best, other people will say that diet is the best, but I am someone who's been on probably 10 different diets just to kind of deal with some of the other health issues that I've had through my life. And I have experience with all of them, and some of them have their merits, and some of them have their downsides for sure. But in general, things that are pro-inflammatory that you might consider removing from your diet would be things like sugar, which is a major inflammatory agent. Gluten and dairy are two of the other ones, which sometimes get a lot of bad press, and then other times people are like, no, they're fine. But they really do heighten the immune response in the body. So it's not a blanket statement to say kick them out of your diet, but you might just want to take a look and say, oh, I had pizza last night. Gosh, my stomach, I don't feel right today. That kind of low grade, I don't feel so good, that can be a sign of inflammation. So in terms of diet, again, sugar, gluten, dairy, alcohol is a big one for people. And one of the other ones that people don't always know about are nightshades. And so nightshades are tomatoes, peppers, eggplant in that nightshade family. And that actually can increase inflammation and joint pain. Not for everyone, but if people are having joint pain, if they have an autoimmune arthritic situation, then sometimes that can exacerbate joint pain. So those are some of the things in diet that would make it worse. Processed foods will also make it worse. So if you think about what is the rainbow in terms of fruits and vegetables, those things have wonderful antioxidants. And there's so many healing agents in the foods that grow in the ground or come from a tree. And you don't have to be vegetarian or vegan. I mean, you don't. You just need to know that you need to have a lot of those really healthy foods in your diet. And then there's also things like chia seeds or hemp hearts or flax seeds that have a lot of really powerful benefits. Nuts and seeds are super healthy, and they can also decrease inflammation as well. Obviously, in small amounts, you don't want to eat a whole bag of chia seeds or something like that, but there are tweaks that can be made along the way that can really make a difference for people in terms of inflammation.
Charlotte, I start my mornings with turmeric with curcumin is really good for reducing inflammations, and ginger, lemon, that's my and I'm sold on that. But for a while, I was wearing my continuous glucose monitor, and I learned so much about my body and the foods that would contribute to the inflammation or the inflammatory response. So let's talk about the topic of blood sugar levels and insulin resistance and how they play a role in inflammation.
Sure. So, what can happen in the body? We have a checks and balances system when it comes to blood sugar, right? So, we eat something, our body says, oh, okay, here's the carbs here, and our blood sugar goes up, and then we secrete insulin to bring the blood sugar back down to regulate things. But what can happen is if we have insulin resistance, our blood sugar doesn't come down the same way. So when we have chronically elevated blood sugar, and again, I'm not necessarily talking about diabetes, but when we have chronically elevated blood sugar, that will increase inflammation. It also sets us up for other issues in the body, ranging from metabolic syndrome to obesity. It will increase weight. There's just a whole host of things that can happen when the blood sugar is elevated like that. People can have chronic infections. They might not get over the flus and colds the same way, or there can be so many things that happen when that blood sugar is elevated. And making sure that you're using your diet as a great way to keep the blood sugar in check, along with exercise and again, medications. Like these are all kind of branches of the tree of creating a healthy body, is one of the ways that you can really work on stabilizing blood sugar. And in terms of food, the continuous glucose monitor is an amazing tool. And so many people love it because it's like, oh my gosh, I just had white rice. I thought that this was okay. And then your blood sugar is through the roof. And what you don't want is you don't want these huge spikes, right? You want something to come up and then gently come back down. It makes you feel better. Like think of having a candy bar where you get a big hit like that. That's your blood sugar spiking versus you have some oatmeal. Well, that is going to definitely raise your blood sugar, but it's going to keep you full longer and you don't feel that kind of like jittery, just off. So there's ways to tweak things. A low glycemic index food means that when you eat a food, it won't spike your blood sugar super high. So if you're looking at what foods to eat, you can just Google low glycemic foods. And it's called glycemic index. So if you compare the glycemic index of like an orange versus blueberry, well, which is going to be higher? The orange. Even if the orange is healthy, your blood sugar is still going to spike, which is the reason that berries are things that are so wonderful because they're packed with a lot of antioxidants and phytochemicals, but they're not going to spike your blood sugar in the same way.
Well, yeah, I don't know if you guys follow Goddess. I think that's her name on Instagram, but she gives you all these different hacks that you could implement in order to stabilize your blood sugar and not get those spikes. And she always talks about dressing your carbs with veggies or having protein before carbohydrates, and that reduces the spike, or apple cider vinegar. That's another great one, right? Take
Mhm.
a shot of apple cider vinegar before a pasta meal. So there's definitely ways. And I love that you highlighted those spikes throughout the day contribute to the inflammation. So thank you for touching on that.
You're welcome. I was going to say, I hope it's okay to just add one more thing. But the other thing too is when you have that afternoon crash, that can also be because you're not stabilizing your blood sugar well enough to be able to sustain yourself through the afternoon. So if you're just having salad for lunch, well, that's great. But what's on your salad? Like you need to have some protein on your salad, have some fats on your salad. So have some pumpkin seeds, pepitas, or have sunflower seeds or have some walnuts with it because what that'll do is that will attenuate or just buffer the really high spike of the blood sugar that can happen when you have carbs in isolation. You always want to have carbs need a friend because that'll keep the blood sugar spike from coming down. So they really need fat and protein to keep that down. But you can always add a little fat to the carb and it'll kind of keep it low. But there are various hacks like that. But that's why thinking of well-rounded meals. So having meals that have carbs, fat, and protein, and especially if you're considering perimenopausal inflammation, menopausal inflammation, protein forward diet can really help reduce that inflammation because it can stabilize your blood sugar throughout the day.
Wow. Oh my gosh. Okay. So we've touched on nutrition and health. We've touched on exercise. We've touched on peptides. Now, one more thing.
Mhm.
So stress, right? I know.
Big one.
My boss, my best friend, stresses me out sometimes. Um, but how does stress and like high levels, talking about spikes, right? Like sometimes we're super stressed and sometimes we're not.
Mhm.
But how does a spike in stress kind of tie in with that chronic
I
inflammation?
never stressed you out. Oh, I gotta do a
Not
better
always.
job.
She also helps with the community and reducing the
Yeah.
inflammation.
It's the checks and balances,
There
right?
you go.
Yeah.
So do husbands. LOL.
Yes.
Sorry.
So what can happen is, stress kept us from being eaten by like the bear and the tiger, right? So the bear comes out of the woods and our heart rate spikes, we can see really well, and guess what? We can run really fast. But when the bear goes away, we need our body to settle back down because otherwise you are in a state of fight or flight, which is when the sympathetic nervous system, which is the fight or flight nervous system, kicks in. But that isn't a healthy state to be in because what happens is our cortisol goes up, and then cortisol raises our inflammation. Cortisol raises our weight. Cortisol just wreaks havoc on everything. There's something called the HPA axis, which is what regulates the cortisol release between the brain, the two places in the brain, and the adrenal glands. And what can happen is, especially when hormones shift in perimenopause, is you can have HPA axis disruption, which just is a big fancy word for all of a sudden your cortisol is going to go crazy because your hormones are shifting. And then if you add on more stress from kids or work or a boss that is cracking the whip, I don't know. But the thing is you need to have the off button. And the off button is what's really hard for people. And that's where, again, things like community coming in. Rest is critical for our health. It is so important. And as a culture, Americans do not they don't value rest the same way other countries do. And I hope that it comes back because it's so critical for our health. But one of the other things that we haven't yet touched on is there are a lot of mind body techniques that can help with stress. So things like meditation are proven to decrease inflammation. They're proven to decrease stress. They're proven to make us think better. I remember years ago when I was doing internal medicine, I had this very VIP patient came in. He was a CEO of a big company, and I mentioned this to him, and he was looking at me very incredulously. And I'm like, look, if you offer this program to your employees, they're gonna work better. You'll have less sick days. People will be happier. You'll have greater employee retention rates. Then he listened. Because the thing is when you decrease that cortisol and you put people into a rest and digest state, you can actually think better. You can access more of your brain. So that's when it allows the body's hormones to start functioning better as opposed to just being like, oh my, you're white knuckling it through life. And the problem is when, again, cortisol levels go up, and our hormones are going down, it's just this roller coaster. And when the cortisol levels are high, we have more inflammation. And that's just, the sum and substance of it.
So you briefly mentioned sleep.
Mhm.
Does sleep also contribute to cortisol production? And maybe you could talk about why sleep is so important for reducing
Sure.
inflammation.
Yeah, so sleep is the time for our body to reset. It's the time where our brain, where we have these particular cells called microglia, which are this big fancy word for they're these little Roombas that go through our brain and they clean up the byproducts of normal function. And what can happen is when we don't sleep, those cells don't clean up as well. And so we get these debris building up in the brain. And it actually can, for people who have dementia and Alzheimer's, we're actually seeing these areas that were not cleaned up because these cells couldn't work. So it actually has significant impact on our health and cortisol and inflammation. So we need sleep to rest. We need sleep to restore. We need sleep to allow the hormonal system to do what it does when it's off. So we have melatonin, which is a natural hormone that's produced in our brain. It's regulated by light, and blue light actually shuts down the melatonin production, which is the reason that people take melatonin to try and sleep before bed. And all of these things are critical for our overall health. So if we don't sleep, we can't function, we can't think straight, and we have increased inflammation. because the cortisol levels can spike in the middle of the night. But then what can happen too is when we wake up in the morning, and that's the time when the cortisol is actually the highest. It's the highest when we wake up. It's called the cortisol awakening response, and it's really high, and then it slows through the day. But what can happen is if you're not sleeping at night, you can have that bump in the middle of the night, and then it just shifts everything and really dysregulates the whole system. And when you've had cortisol elevation for so long, what can happen is you can actually burn yourself out. The word in functional medicine is adrenal fatigue. In allopathic medicine, it's if you were to ask an endocrinologist if they believe in adrenal fatigue, most of them will tell you no. But what it just means is you've had these really high elevations of cortisol for a long time, and the body gets tired. And so then what can happen is you can do some testing and you can see the cortisol levels are lower when they should be high. Now, it's not so low to be a condition called Addison's disease, which can be a life-threatening situation. JFK actually had Addison's, and you have to take hormones to be able to keep your cortisol elevated. But what it does is it just doesn't allow you to function. So you're exhausted. You can't think at all. You can barely get out of bed. And it really takes a long time to recover from that. So that is just one example of why sleep is so important, and focusing on reducing stress and overall life, which is hard in this day and age. But reducing stress matters as much as anything else. It matters as much as your diet. It really has just such far-reaching implications.
Now, on that note of getting better sleep, do you have any tips for individuals who are struggling to sleep throughout the night? They wake up because they're stressed. So you mentioned meditation, but is there like coffee? Don't have coffee past it. Do you have any tips for
Sure.
people to get better sleep?
Yeah, so the kind of the basic ones that a lot of people might know about or they might not is the general recommendation is to not have caffeine past 2 p.m., which can be hard because you've got that afternoon slump, but it's about 2 p.m. The other thing is to make sure that you're off screens about 2 hours before bed, because the blue light coming from the screen coming into our eyes makes the gland in our brain stop the melatonin, our natural melatonin production. And melatonin is what helps us sleep. So here we have a device that we're looking at that's turning off the hormone to make us sleep. So that's something. You can also make sure that you, if you can, get devices away from your sleeping area. And this gets into some interesting things, but our phones set off, I mean, these have, signals that come out, and a lot of people are very sensitive to them. It's EMFs, and that can actually dysregulate sleep. So make sure your phone is off is another really good one. It's super simple, but just turn your phone off. The I wouldn't, some people find that exercise before bed is helpful because it makes them tired, but other people, they find that it makes them wired. But I find that it's almost like for little children. You want to have a wind down routine. And if you keep it regular and say, okay, if I want to be asleep by 9 p.m., what time do I need to eat dinner? What time do I need to take a shower? What time do I need to like tidy up my room or whatever it is that I need to do, read some before bed? And you kind of work backwards and say, I need to be in my bed by 8 in order for me to be going to bed by 9, as opposed to I want to go to bed by 9, it's 8:45. So planning your sleep can be really helpful. There's some other things that are really good tips for sleep hygiene, making sure your bedroom is dark, so turning off all lights, and that includes the charger from your phone or your laptop or whatever. You really want to make it dark, making the bedroom cool at night, which for most perimenopausal and menopausal women, we love that. So anywhere from 65 to 67 degrees, if you can tolerate it, that can be amazing. And the blue lights are another one. Caffeine, I'm going through the checklist in my head. And those are really what I would think about. The other thing is too, is one of the things that people may not know is limiting food before bed. So if you try and have your last meal a couple of hours before you go to bed, you actually will sleep better, and the sleep will be more restorative as opposed to going to bed with a very full stomach. So that's something that people can try and see if it makes a difference.
I love that you touch on this because we have a lot of entrepreneurs here on this call and we're always on our phone. And these are things
Mhm.
that we do know how disruptive blue light is to our sleep. But it's
Mhm.
so wonderful to hear it again because I'm Guilty of that on my phone before bed. I've also heard taking a shower, a warm shower before bed is helpful because it raises the body temperature. And then there's a big delta for your body to cool down. And it supposedly helps. It was on a Huberman episode. But thank
Yeah.
you so much for the reminder of how important it is to have good sleep hygiene and just take that time to prepare your body to wind down.
You're you're welcome. I mean, there actually, I'm sorry, like sometimes I get like the threads of, oh yeah, and I forgot something. There is one of the things that I've incorporated into my practice is something called Ayurveda, which is an Indian mind-body medicine. And one of the things that they recommend is using certain oils on the bottom of your feet before you go to bed, because we have a lot of nerve endings on the bottom of our feet. And there's, sesame oil, coconut oil, various things. You want to put socks on, but you can just do like a tiny little foot massage. It could be like 30 seconds each foot, 20 seconds each foot. But it's one of those things that can help just regulate the nervous system, which is so responsible for how quickly our brain can turn off. And again, if we're in fight or flight and suddenly we're like, oh, I got to go to bed, it's not going to work. You got to wind things down slowly. And it takes practice. It really does take practice. And sometimes people say, I can't do it. Well, if you start with some of these small things, they add up over time.
Yeah, and it's all like intertwined too, because like you said, if you just start by planning out your day, right? Like if you turn your phone off, well, you can't wake up early in the morning, you can't exercise in the morning. Why? Because you were up late at night, because you couldn't sleep well. And it's just like this whole thing is so intertwined. Most people know this, but I'm a huge advocate for working out early in the morning. I am like the 5 a.m. club type of people. But I think that sometimes when you're starting out in your health journey, you're starting out in your exercise journey, there's a fine balance of like, oh, I need to exercise this hard, or I must be sore or else it's not working.
Yeah.
And there's a fine line that like it's working, you just have to keep doing it. But then if you go too hard, too fast, too soon, that also leads to inflammation. So can you kind of touch on like the balance between exercise and inflammation, and where does it help? Where does it hurt? Like,
Sure. So, I actually used to do ortho and sports med, so this is something that I have talked to people a lot about. But one of the things to know, our bodies are made to move. Look at a child. The kids are running around like crazy, They have all of this energy. They're up and down because our bodies are made to move. They are essentially machines. Like we have to move certain things. When you aren't moving your body and you aren't moving joints, people get very stiff. And being sedentary, not moving at all, actually has significant health repercussions. It's not just somebody just, cracking the whip and saying, oh, you got to go do your exercise. It's like, no, this is really important because you want to be able to reduce the inflammation that can come with being sedentary. So when people are going from not exercising to exercising, there is a little bit of a normal inflammatory response. It's just going to happen. But it's not to the point where you can't get up the stairs or you can't sit down in your car. That is, oh my gosh, it's too far. So some of it is listening to your body and saying, okay, well, if I wasn't working out, maybe I could start with a 10-minute walk. So something really small and very doable. It's that very like actionable step. So it's specific, it's measured, and it's attainable. And it's not like I'm going to go and I'm going to, run a marathon today. No, you're not. You need to just walk down the street and come back and make sure that you're okay. So some of that is just planning things out the same way you would plan out if you were you want to go to bed a little bit earlier. Some of it takes planning, but finding a good middle ground, that kind of middle way between I haven't been working out and I'm going gangbusters, joining, I don't know, going through boot camp. You don't want that, because that can actually happen is you can cause the muscles to have significant inflammation that can actually be very dangerous once you kind of cross a certain point. So you want to have a little soreness, is the easy way to say it, but you don't want to be in pain. There's a very fine line there. So a lot of people who haven't been working out, or maybe they've been working out a little bit, walking is the safest exercise. Safest, easiest, we can all pretty much walk. And then if that works, then you slowly add some time. So maybe you're adding 2 minutes a week, you're adding 5 minutes a week, something where it's a gradual increase. It's not just a sudden burst of activity like that. Now, in terms of strength training, which is wonderful for people, and it's so important as we age to continue having our muscle, because muscle is critical. Muscle is what keeps us out of the hospital. Muscle is what keeps us from falling when people are older, and we need that. And muscle naturally, we lose muscle mass with age. So we want to keep that by doing strength training a couple of times a week if we can do that. And there are various ways to do it. You can have a trainer, you can have someone guide you. But again, it's beginning with small weights, starting there, picking them up and putting them down. And then gradually you increase. It's not like I have to suddenly be Arnold Schwarzenegger tomorrow. No, it's over time. And over time, all of these things add up. It's consistency, it's quality, and just making the commitment to doing that and doing a little bit every day, and a little bit adds up.
Yes, yes. If I could just add something, I love that you said starting with small weights, because I feel like sometimes there's this like thing, right? You like see it on social media or whatever, and you see these girls lifting like these insane amount of weights.
Yeah.
Like I was at the gym this morning, I had the fives,
Me
and
too.
just
Sure.
like the fives,
Mhm.
and everyone's like, oh my God, Janet, like, like you still have the muscle is working. It
Mhm.
doesn't need to be a heavy weight, like, so I love that you touched on that. Thank you. Yeah.
Mhm.
You're welcome. I mean, I have done a lot of weight training myself, and I've had various programs, and there are various schools of thought about weight training. Some of them it is you really lift very heavy and in small amounts, and then small volumes, and then others it's more moderate and more moderate volumes, and other it's light weights with a lot of reps. And so it really depends. Some of it I find with people who've had a lot of sports injuries or musculoskeletal injuries, arthritis, they might not do as well with the really heavy weights. And they might do better with lower weights, higher volume. But you got to start somewhere. And it does have to be a little bit of an effort. Those last few reps, you got to struggle a little bit. It can't just be like, oh, I'm just, lifting it like this. No, focus on the muscle, focus on lifting it up and down, watch your form, make sure it doesn't hurt. And it always is helpful to have someone guide you so you know the ranges of motion, and you're not asking your body to do something that it wasn't meant to do. Simple programs as opposed to something really complex is much more doable. So when you're at the gym and you're seeing all these people lifting a lot of weights, they've been lifting for a long time.
Mhm.
It takes time to get to that point, and it takes consistency. I mean, I was lifting in the gym 5 to 6 days a week. I mean, I really pushed my volume, and it was hard, and my body paid for it. But every program is different. But again, it's that consistency. If you're not lifting now, go ask the people at the front desk, say, hey, would you show me 5 different things to do? Just pick 5. So a couple times a week, you're doing 5 different activities, super easy number, not like, can I do 15? What's this, every different equipment? No, just the big muscles. What is this? And just so you kind of get your feet wet. And then after 3, 4, 5 months, you have a better sense. And then you switch things up, and it works from that. But it doesn't have to be like recreating the wheel. It can be very simple steps, but having someone to guide you is always really important, especially if you're starting out.
Coach Chantel asked, how about Pilates? Is that a great
Oh my
place?
God, I love Pilates. I love Pilates. Oh God, I'm going to wax on about Pilates now. So Pilates is so amazing. Pilates is one of the things that so with my health journey over the last almost 5 years, I got COVID in 2020 when I was practicing. I was very ill. And then I developed long COVID and a heart condition called POTS as a result of that. And Pilates has been one of the few things that I've been able to do that doesn't exacerbate the heart issues that I've had. And Pilates is so wonderful because it trains our core, and our core is it's everything, right? So if we have weakness in our core just isn't our abs. Our core is everything that's surrounding the hip girdle and then up into the lumbar spine. And when we're walking, we need the strength around our hips and around our stomach to be able to hold us upright so that we don't fall. And again, the reason I'm saying falling is because that is one of the major things that puts people in nursing homes when they're older is a fall and a hip fracture. And that can be prevented with daily exercise and with strength training. and using the muscles around the hip to really strengthen it, because it's like a tree with an unstable foundation. The wind comes and it can fall down. So I love Pilates. It's doable for everyone in every season of life. And there's some wonderful instructors out there. I have a favorite who's a physical therapist. She's online. She's free. She's on YouTube. You can do Pilates in a chair. You can do it laying down. You know, if you have the luxury of joining a club and being, you know, on a reformer, that's wonderful. But it can be very, very simple and very doable. And I've recommended it to people in their, you know, teens to people in their 80s. So it really is wonderful. It was actually created because someone had an injury and they wanted to get stronger from a hospital bed. So it literally, you can do it laying down. Even if you've had anything that won't let you stand up or sit in a chair, you can do it laying down. And that's a wonderful thing.
Mm. Thank you for
You're
sharing.
welcome. I'm sorry, I get really excited about
No, I love it. I love it all. This is really important. I think people don't understand how important inflammation is in the body and these topics around reduction of inflammation. So thank you for touching on that. Exercise is very important. Now let's go back and talk about our favorite peptide, the GLP-1s, the GIPs, tirzepatide, semaglutide. I'm proud to say I was one of the very few companies out there to advocate for the longevity dose of tirzepatide on a platform, and our doctor networks didn't want to do it. They're like, no, it's for weight loss. And I was like, no, we got to get it out. Dr. Tina talks about it. So many people are talking about the longevity benefits and the anti-inflammatory benefits of GLP-1s. Can you touch on that? Beyond weight loss, what are the benefits of GLP-1s and GIPs?
Sure. So one of the things that the GLP-1 slash GIP and the GLP-1s do is they regulate immune cell signaling. And our immune system is what really determines part of the inflammatory response. So they decrease inflammatory cells and they increase the anti-inflammatory response. They are potent anti-inflammatory agents that don't have the side effects that most anti-inflammatory agents do, like Advil, aspirin, Aleve, and the corticosteroids. So they also decrease oxidative stress, which is the imbalance between our body's kind of antioxidant system, for lack of a better word. And they lower systemic inflammation, which helps with weight loss and helps with pain reduction. They decrease blood sugar, which also then thereby helps decrease some of the inflammation as well. They have some mild antihypertensive effects. They can be cardiac sparing after a heart attack. I was actually listening to a lecture by a cardiologist who does functional medicine and uses the GLP-1s for his post-heart attack patients for myocardial salvage, meaning you have a heart attack, you have part of the heart that dies, and he wants to allow the rest of the heart to survive. And one of the cool things, and this gets a little nerdy, but these medications can actually help the body. Uh, I'm sorry, my brain just had a little synapse lapse there. They actually help the body decrease so much inflammation that you are using them in situations that have really high inflammatory responses, like after a heart attack. So they can be just really wonderful aids in that regard.
And you mentioned oxidative stress and GLP-1s. What
Mhm.
about NAD plus? Like what makes that such a powerful tool for reducing that oxidative stress and inflammation on the cellular level or at the cellular level?
Sure. So, NAD is a peptide or coenzyme that's responsible for, gosh, like 500 enzymatic reactions in the body. And it's just amazing. But what it does is it balances oxidative stress by balancing the reactive oxygen species associated with chronic inflammation. So, again, it's a checks and balances measure. And it also helps regulate some of the immune cells to promote the kind of anti-inflammatory type of cells within the immune system. It can also help some with DNA repair too. So these two medications, the GLPs and NAD, really do have great anti-inflammatory properties, both directly and indirectly.
We have some questions that have come in, and please feel free to post your questions. But Jen asked, when losing weight rapidly, Can our CRP blood work or inflammation increase temporarily?
So the answer is it depends. It depends what other health conditions are happening. There are some people who really like to have a baseline CRP and then see what happens after you start the GLP-1. In my experience, the CRP typically goes down very quickly. So if something's going up, there could be something else that's going on, and that might warrant further investigation.
Tracy asked, and I'm of the younger generation, obviously. So we're all about like the social media and the TikTok and buzzwords. And right now, a big buzzword is red light therapy. How does that help? How does that tie into all this? How do you feel about it? Because that's also very like, you
Contradicting.
contradicting information out there.
So red light therapy has been around for a while, and there are a lot of proponents. I have a red light that I use. I will shine it directly on a joint, and I do think it helps. It's actually used a lot in the veterinary community too. So it can be used for cold laser. Like there's a variety of things. But what it does is it kind of helps the body promote healing in that particular area through a variety of means. There are also some masks that people have seen, like
Yes.
you'll see the people on social and they're wearing this mask and you can see their eyes. But what it can do is it can help with cell turnover. It can help with some anti-aging benefits. So there are a lot of benefits. It's important that you get the wavelengths right and you buy something that's of good quality because otherwise, one, you're wasting your money and your time. But there are a lot of benefits in that regard. It's kind of there are a lot of people who like sauna. Some people like red light sauna. I mean, there's a variety of things that you can do on the kind of biohacking side. It just depends on how you feel. And so, one of the things I always love to encourage people is our bodies have innate wisdom, especially women. We have a wonderful spidey sense. We just turn it off. Well, we need to turn it back on and we need to listen to what our bodies are telling us. So, if you're doing something and you're feeling like this isn't helping me, look at that because your body's giving you the signal. So if you're doing red light therapy and you're saying, I don't think it's working, then something needs to be tweaked. So you might need a guide, you might need a different um, red light. Like there's a variety of things in that regard. So I hope that answers the question.
Beautiful. And as you all know, we launched GHKCU today. And as I was going through the papers, I came across that GHKCU helps with inflammation. But besides GHKCU, are there any other peptides that you like for reducing inflammation in the body? Anything else you'd like to touch on and mention?
Well, my favorites really are, to be honest, the GLP-1s and the GLP-1/GIP. I like that in the therapeutic standard dosing for weight loss. I love microdosing because I think it just can be so beneficial for people across the BMI spectrum. And NAD is one of my other, favorites. So I would say those are my heavy hitters. And I really feel like, sorry, I have a dog who's telling me it's dinner time. It's not dinner time yet.
2 more
Um,
minutes.
but I think that the GLP-1s and the GLP-1/GIP, I really like the dual combination that tirzepatide offers. The studies for that are really great. And I think that it's such a potent anti-inflammatory. I think in combination with NAD, I really think that that's a stellar combination.
I love that. And there's so many, and they have dual effects. The BPC helps with them. I mean, it seems like across the board, a lot of these peptides help with reducing inflammation by healing tissue and repairing. So thank you for touching on that. Now, Charlotte, I've been following you on social media. I love the content that you're
Oh, thank
producing.
you.
Anyone wants to get in touch with you, where can they find you? And guys, I highly recommend that you follow Charlotte. It's got fantastic content. Where can we find you?
Oh my goodness, thank you so much. That's so sweet of you. You can find me on Instagram and TikTok. It's charlottemathis.pa. And so it may be in my name on the Zoom link. but you can find me there, and I do pop in sometimes with reels to the Longevity Collective, which I love. And I love EllieMD so much, and the community and the educational series is so powerful because I think EllieMD is one of the few companies that's doing this and really empowering the patients and giving the education to be able to understand not just the products, but how our bodies work, and encouraging us to understand. And I really am a big proponent of women having great healthcare all around. And it's so multifaceted. And so I really am so happy to be part of this community. And I appreciate the time and the chance to answer some of these questions. I hope well.
Oh, no, thank you so much. This is the most important part of our community, the educating. And when I was thinking about creating a company, it was around this educational piece and a community to bring into. So for all of you who are here tonight, thank you for being part of this community. Thank you for joining us. If you invited someone to this call, thank you so much. We're going to put the replays out. Charlotte, can't thank you enough for coming on and helping educate our community. And we're gonna have you back very soon. Thank
I
you for
love
this
that.
topic. This is something that's dear to both of us. So thank you, thank you,
Thank
thank you,
you.
everyone. I hope you enjoyed this. Have a beautiful evening. Enjoy. We'll see you soon.
Okay, bye. Thank you.
Bye. You're welcome. Take care. Bye-bye.